Welcome to the weekly series of Caring Conversations Empowering Lives for Cancer Care. In this series of events, we come together with eminent experts in this field of cancer care so that we can together empower cancer patients as they fight their disease and battle against this deadly disease. In today's event, we will try to understand what is meant by various stages of cancer and how it is determined. Then we will hear from a special guest, Saili Umesh Naule, about her encounter with cancer and try to learn from her personal experience. We'd encourage you to ask your questions to the experts and our speakers by typing them in the comment section. We will take them up at the end of the session. Let's begin with today's session of Beat Cancer Facts. When a patient is diagnosed with cancer, the first thing that the doctor does is to ask them to do a biopsy report. That is basically taking out tissue from the cancerous region and try to determine what is the stage of the cancer, what is the specific characteristics of it. This describes the size of the cancer and also how far it is spread. It is very important to understand the various stages of cancers for several reasons. First, it helps the doctor to decide which treatment will work best for the specific cancer type. An early stage detection may call for surgery. It may be just possible to do a surgery and remove that cancer. But if it is detected at a later stage, other interventions may be needed, like chemotherapy or radiation therapy, and the doctor can decide on which course of treatment to give based on the stage. For the patient or the caregivers, it also helps to determine the outlook that is there a possibility for the patient to recover based on the stage of the cancer, how early it is determined. And the cancer stage will give the possibility of outcomes. What could be the realistic outcome based on the patient's detected stage of cancer? Then again, it also helps in research because many hospitals work with a national database that keeps track of which treatments are used, when they are used, and how well they work. Researchers can compare similar cases to find the most effective treatments. Now that we have understood what is the importance of staging for the cancer, we will try to see what are the different stages of cancer. the doctor uses the doctor will use the information from various test results, or possibly the tumor itself, and then decide the overall stage of the cancer. So most cancers that involve a tumor are staged in 5 broad groups. They are usually referred to with Roman numerals like 1, 2, 3, 4. There are various staging criteria for different type of cancers, and then like blood cancer, lymphoma, brain cancer, they have their own staging system. But the main aim of staging for all of these cancer is to tell how advanced the cancer is. Now, coming to the staging categories, the first stage is stage 0, which means that there are no cancer, only abnormal cells with the potential to become cancer. They are also called carcinoma in situ. There are many cancers in which there is only a possibility, the potentiality that the cells may become cancer, like a mole for a skin cancer. But if there is any abnormality, then we can say that it is stage 0. Then there is the stage 1, which means that the cancer is small and it is there in only one area. It is also called the early stage cancer, and maybe the best possible stage at which to get it detected for effective treatment options. Then there are stage 2 and 3, which means that the cancer is large and it has grown to nearby tissues and lymph nodes, as you can see from my diagram. And then stage 4 means that the cancer has spread to other parts of the body, it is also called a advanced or metastatic cancer. Now, we may try to understand what are the several physical exams or tests which can determine the clinical stage of the cancer, that is, how far it has progressed. These tests may include blood tests, other lab tests, and also imaging scans. Imaging scans may be using radiations to measure the progress or picture what the tumor is like. So these can be like x-rays, or they can be other powerful methods like magnetic resonance imaging, or MRI as it is more widely known, which uses powerful magnets and radio waves to make a detailed picture of the affected area. Then there are also CT scans or computerized tomography scans, which takes X-rays from different angles and then they put together to show more information on the cancer. Other methods are also used like ultrasound, especially for tumors in the stomach, etc., where a high frequency sound wave is used to make images inside the body. And then there are other methods like biopsy, which is known to be the gold standard to determine what stage of the cancer is in. So for in the biopsy, they take a small piece of tissue from that cancerous area, and the pathologist will see it under the microscope to determine the stage of the cancer. Now, there are different doctors from different areas of the world may use different nomenclature or naming systems to determine the stages of this cancer. And then there is a standard nomenclature which is followed, which is called the TNM system. The TNM system basically means the tumor size, the node, and the metastasis. So that is abbreviated as TNM. So what it measures here is tumors. As you can see from the diagram, these are written as T, then some number, then N, then a number, and then M. So this determines how far the tumor has grown or progressed. So when we say T0 to 4, it will tell you how large the tumor size is. 0 being the smallest size. If it is T0, it means there is no measurable tumor. Then higher the number, the bigger the tumor is. Now, N or node means again how far the cancer has spread in the lymph nodes, which is surrounding the tumor area. So the new lymph nodes are the glands that filters out various viruses and bacteria before they can infect other parts of the body. So that is also a way of circulating tumor cells in the body. So N0 means lymph node are not involved. And then again, the higher number means that the cancer is spread to more lymph nodes and farther from the original tumor. And the last one is metastasis or M, which is followed by either a 0, 1 or 1. In some cases, doctor also write MX, where they don't know whether the tumor has spread or not. So, and if it is 0, M0, that means the tumor has not spread. And if it is M1, then the tumor has spread. So that is in a nutshell the TNM system of staging of cancer. And when you correlate it to the stage 1, 2, 3, 4, as you can see from the diagram, they are pretty much the same thing, but in different ways to determine what are the stages. Then there are other factors also where doctor look at other information to see the clues, how the cancer will behave, how far it has spread, etc. One of them is the grade. So when you see a grade, as you can see from the picture, it determines how the cancer cells look under the microscope. If it is a low grade, that will mean that it looks a lot like normal cells. That is, it is very structured in a well defined manner. And high grade means that they will look abnormal. Low grade cancer cells will grow more slowly and are less likely to spread than high grade cancer cells. Then other factors that determine if the tumor can be treated or not means where the tumor is located, If there are tumor markers, like we talked about in previous sessions, that there are specific genetic markers which can determine the level of the tumors, the specificity of the treatment, etc. And then again, the genetics, like we talked about. So if there are specific genes which needs to be targeted to treat the tumor. So once the doctor has all of this information and has assigned numbers to T, N, and M, they can then determine the overall stage of the cancer. I hope this brief information will help you now to understand better when you hear something like the stage of the cancer. Cancer has been detected in this stage. This is how advanced it is. This is metastatic cancer and other such things. Now we will come to the next part of today's event, where I would like you to I would like to introduce to you a very special guest. She is a remarkable individual who brings not only knowledge but also a deep personal perspective to today's event. Having experienced the profound impact of cancer firsthand, she is here today to share her journey and insights to help raise awareness for those dealing with the disease. From the perspective of a caregiver, it may help us understand the challenges that they face. Welcome, Saili, to our event, and thank you for agreeing to join us and share your experiences with us. Welcome.
Good afternoon, everyone.
Saili, as we start, can you please tell us a little about yourself and the ordeal that
Yes,
you have faced?
yes. My name is Saili, and I am 32-year-old housewife. My father has liver cancer at the age of 60, and liver cancer was diagnosed at February 2023. And we have gone through the very horrible phase of the life.
So you said that he was detected in February, and then it was a very difficult time for you when it was diagnosed. So looking back, before the cancer was diagnosed, were there any early symptoms that were not paid attention to, or it could have helped you to diagnose the cancer early?
Yes, before the cancer was detected, as I told you that cancer was detected in February 2023. I still remember the date. The date was 10th of February. Before that, in December 2022, he was feeling sleepy all the time, all throughout the day. Also, he was feeling tired all the time. His appetite was very low than before, and he was not eating well, but he was eating because it is necessary. But he was not feeling that hungry uh, as he was feeling before. That was the only symptoms. In December 2023, I was not with my father. My mother was with staying with my father, and my mother considered that it may be happening due to the age because he was retired from a high school. He was a teacher. So at the age of 60, my mother considered that due to the age this is happening. So they ignored that. So the December have passed, and in January, first week, he was suffering from a fever constantly. So he went to the doctor. Doctor said this is the viral, and he medicated some tablets and injection. So he was feeling well after that. But in next week, he again had a fever. So this cycle repeats in complete January was like this. In February starting first week, he was feeling bloating inside the stomach. So he went again to the doctor. That doctor was a general physician. As they are staying in a small town, the specific doctor was not available there. So they went to the general physician first. The doctor told that this is due to the gases. So they prescribed some medications. But after that, 2 to 3 days medication, he was not feeling well. So they means my father and mother went to another doctor for the second opinion. So that doctor was a Ayurvedic doctor and family friend also. They checked my father and told them that the water is accumulating inside your stomach, not in intestine, but between the two organs. So immediately you need to see the gastroenterologist. So as I told you, that was the small town and gastroenterologist was not available there. So they need to move to another city for the gastroenterologist. After 6 to 7 days, they moved another city and they went to visit the doctor. Doctor immediately told that get admitted here, and they remove all the water and done all the tests like blood test, urine test, CT scan, and fibro scan, and other tests may include that. So they, after 2 days, the report has come, and doctor said that the liver cancer is detected at the last stage, and that too at the advanced level, and the cancer is spread in lungs and intestine on and other organs too. So that was the advanced level of cancer. That was the symptoms only, means the bloating in stomach and the fever was the main symptoms, and loss of weight was the major symptoms. Before that he doesn't have any symptoms, means 1 or 2 year before, when the cancer may there at the stage of first or second, he doesn't have any symptoms of like this, means a lot of loss of weight or loss of appetite, anything. There was no symptoms
So he
before
was
this.
like he was like just like a healthy individual going about his daily work, going to school, and like you said, he's a teacher, so maybe must have been very active
Yes,
in
he
doing.
was very active, and when he was retired actually in 2021, but he was doing all the household work with my mother. He was very helpful to my mother and very active.
Yeah. So sometimes these are like small symptoms, which as you said, you had already gone to the doctor, but they had not thought that it could be cancerous. They have just treated it in the normal way, and then maybe it went out of hand. So when it was initially diagnosed, what were initial actions? I know you must have tried to get a second opinion, or you tried to consult others. What were your initial actions?
So initially, when the doctor told us that the cancer is at advanced level, also they told where when the reports came, also he had a jaundice at severe level. The numbers are very horrible, and also his kidney was swollen and the body is not responding to any medication. Also tumor was there in liver, so cancer was started at liver. The tumor was of 12 centimeter big, and other few tumors are also around the liver, and the cancerous cells was spread all over the body. His body is not responding at all to the medication, but still doctor was giving medicine for jaundice and kidney purpose only. So doctor suggested us that you can go for chemotherapy. The chemotherapy will may help or may not help. They only throwing ball to in our court to decide whether you want to give the chemotherapy or not. If we started the chemotherapy, side effect may have, and he is not responding the medications. So you need to decide. Means family need to decide whether we want to give the chemotherapy or not. So at this point, we have gone to the second opinion, and we have gone to the another cancer hospital. We shown all the files. Uh, we shown all the files, and doctor said this is the advanced level. Uh, Chemotherapy may not help him. He has only 4 to 6 months life for life. and this is a very tough time for us. And the second opinion was immunotherapy. So we clearly asked him what is the chances of life after immunotherapy. So doctor clearly told that even after chemotherapy or immunotherapy, he will live only for 4 to 6 months, not more than that. That was the second opinion.
So I'm like, it's a very rapid decline in the health, right? And this was challenging because he was not responding to the any treatment. So how did you handle this quick progression? I mean, you must have used some support systems to rely on. Was it only the healthcare system, or you had someone to give you emotional support during this time?
Actually, as I said, that they moved to another city. That another city, my relatives are there. My cousin was residing there. So my all family members were was there. 4 to 6 members we are there living together in this tough time. So it was not easy, but we made it easy. Not that easy, but was doing. We are doing that. Also, the tough time was healthcare was not that much supportive because he got admitted for only 6 days. Only 6 days he had admitted. 3 days first week and 3 days the last week. Also Mediclaim is also there. So we didn't face any financial issue that time because doctor already said that we can't do anything apart from the chemotherapy. And meanwhile, my family has decided to give the chemotherapy. As a younger person, me and my brother and my cousin was not agree to give chemotherapy because it's of no use, as doctor told us. So it may be painful for my father, and it may decline the health. The chemotherapy will decline the health. But my mother was hoping that chemotherapy may show any progress in his health. We constantly telling her that chemotherapy will not help her, but just sake of my mother, we were ready to give the chemotherapy. The chemotherapy was in the form of tablet. The tablet was of power of 4 mg. We have started the chemotherapy. That tablet is one tablet a day. So while doing the chemotherapy, my father was at home. What was at home? We are not going to hospital for that purpose. Chemotherapy was held in at our home only. So we gave the first tablet on 20th of February, and the normal day was gone. Again in 21st of February, we have given the second tablet. Like this, the when we give the third tablet, as he was not feeling hungry and not eating well, the tablet is not showing the result. Means the side effect has started. He has pain in stomach, also backache also started, and he was sleeping all the time, not showing any activity. No, he was not taking interest in anything like watching TV or talking. He was not showing any interest in any activity. He just want to sleep and just stay alone, want to stay alone. So after the third day of chemotherapy, he was feeling a pain in belly, and that pain was unbearable for him, and he said that I can't bear this pain, and I want to see the doctor. And again he was get admitted for 3 days. And then after 2 days, he was on ventilator, and on the 25th of Feb, we lost him.
That must have been a very rapid progress, because the doctor had given you 4 to 5 months, but he was not able to live even that. So I can just imagine how difficult the situation must have been from for you and your family. But were there any particular moments or sources of inspiration that helped you to maintain a positive outlook?
As I said that we have 4 to 6 members in family, so we are daily talking and spending good time with my father. Also, my son is 3 years old, so that small child was helping us to keep the environment light. And my father is also enjoying with him because they both are very attached to each other. So that time my child and also some spiritual things are helping us to keep the environment light and positive in positive way.
So, from your personal experience, is there any advice that you'd like to give to someone who is going through this to maintain a positive outlook? Because medically, the healthcare system helps us as much as they can, but the support system that we need, how is that obtained? In your case, you said your family is spiritual, but any other advice that you may have?
The other advice is only is to stand for your family. You need to stand for your family, and family support is very important in this tough time. And if there is a small child in family, so it will be good for them that that patient is also feeling well, and the environment will be positive little bit, and it will kept happy.
Okay. And as you were very close to your father, this journey in itself, I think it was very short. Maybe you did not get the chance to experience all the things. So if you have a friend who is going through the same thing, uh, what would be like, would you like to connect to them on a personal level, or would you like to suggest some other things that this is what you should do, this is what I have learned, right from
Actually,
diagnosis to going through the treatment or anything like that?
Actually, with my father, what happened, the time was very short. As I told you, on 10th of Feb, the cancer was detected, and at 25th of Feb, we lost him. So around the 20 or 25 days, all the thing happens. And in that 25 days, we are only emotionally stand out for our family. That's it.
Yes, and that is how you can support each other and empower each other. So,
Because doctor already told us that chemotherapy and other medication will not help him, so that's why only we can stand out for our family emotionally. So medical will not help you, but only the emotional support is very important at this severe stage of cancer, advanced stage.
yes, thank you, Saili, for sharing this powerful message. I can just hope that his soul rests in peace and he finds a good afterlife. And with that, I'd like to thank you personally for your willingness to share your journey with us. And it has touched our hearts and deepened our understanding of the challenges by people like you, who are from a small town, who do not get the proper treatment but have to migrate to other cities, seek family support. But thanks for letting us know of all these challenges and being a beacon of hope for us, so that others can get inspired from you. Thank you so much for being in our session today.
Just want to tell one thing that if someone is at last stage of cancer and doctor suggested that nothing will happen, so at this stage just spend a good quality time with the patient and family. That's it. That's only you can do. And ask the patient if they want to eat something special. Ask them if they want to share anything they didn't share before, and only spend a good quality time with patient. That's it.
So that their quality of life is improved and they can just keep the best memories with them when they leave us. Yes. Thank you. Thank you so much, Sally, for sharing these last thoughts.
Thank you.
With this, we come to an end to today's event. Thank you all for taking part in this engaging session. We look forward to see you again next week when we will have with us Dr. Shom Shubhro Nath, who will emphasize the need for an actual patient's medical data to help in cancer research, to understand the disease better and lead to a better drug discovery. Thank you once more. See you next week. Take care.